Hi, I am Jaden Jankoski.
And I am Sierra Seeley. We are fourth-year nursing students in the Saskatchewan Collaborative Bachelor of Science in Nursing program at the University of Regina.
The aim of this video is to teach you about the 4 stages of disaster management and the community health nurse's role throughout these stages.
So what defines a disaster?
Well, a disaster is any man-made or natural event that results in destruction and devastation that cannot be relieved without assistance. It is key to note that the event does not need to cause injury or death to be considered a disaster.
Now that we know what defines a disaster, let's talk about disaster management. Disaster management is the organization and operation of resources and responsibilities for handling all humanitarian aspects of emergencies, especially regarding the preparedness, response, and recovery, in order to decrease the devastation created by these disasters. There are 4 stages within disaster management: prevention and mitigation, preparedness, response, and recovery.
The community health nurse is essential in all 4 stages of disaster management. The focus of the nurse is to provide a high level of holistic care throughout all of these stages to the populations affected or at risk of disaster. The first stage we will discuss is prevention and mitigation. Prevention and mitigation aims to minimize or eliminate risks of a disaster before they occur. This stage helps reduce the financial costs of disaster response and recovery. Understanding the risks for disasters is crucial so that effective activities can be implemented to prevent or reduce their impact. Mitigation activities include awareness and education and disaster prevention measures.
Community health nurses have the opportunity to play a key role in disaster prevention and mitigation by advocating for safe environments, creating public awareness programs, and assessing/reporting on environmental health hazards. Nurses should address disasters that are likely to occur in their community and perform a hazard vulnerability analysis to determine the ones that may arise in their facility from those disasters.
A hazard vulnerability analysis is a systematic approach that identifies all hazards that may affect a community, determines the probability of the hazard, determines the consequences of the hazard, and analyzes the findings to determine what hazards are of priority.
The results of an HVA can be used to develop disaster plans. These plans should be designed using an interdisciplinary approach and involve local police, emergency, and fire services.
This leads us into the second stage, which is preparedness. This stage involves being ready to take action and manage a disaster if it were to happen. Planning is a key component to being prepared for an emergency situation. Without clear procedures and guidelines for before, during, and after disasters, it is difficult for nurses to provide high-quality care to affected individuals, families, and communities. Strategies used to prepare are disaster education, team planning, and mock disaster events.
Nurses need to have a personal preparedness plan in place in the case that there is an emergency. Challenge arises when they do not have their own plan in place because they have to attend to their personal responsibilities before their professional ones. Steps to being prepared personally include making a plan and sharing it with your loved ones, build an emergency kit and ensuring it's easily accessible, and being informed through alert services.
Take a minute and pause this video to consider what your current emergency plan is at home, and if you don't have one, take this time to start thinking about developing one.
Nurses with their expertise and experience with interdisciplinary teamwork and strong collaborative skills are the ideal leaders in disaster preparedness. The first step in professional preparedness is developing a strategic emergency management plan.
The processes involved in the management plan include: determine a command and control plan. This involves choosing a command center where the main information will be distributed from, identify functional roles and responsibilities, ensure contact information of emergency personnel is available and all essential service staff are defined, determine a communication system. This should be developed to address the possibility of a system failure, Confirm a legal basis for response to include isolation strategies as needed for infection control. A good example of this is the current pandemic and the measures being taken in our province with COVID. Develop an infectious disease plan. This includes isolation procedures, equipment availability, and a surveillance plan. Obtaining and maintaining emergency facilities and supplies. An example of this is the temporary field hospitals that were built to take the possible overflow of COVID patients. And finally, providing disaster preparedness training for emergencies, donning/doffing PPE, decontamination procedures, mock disaster situations, and triaging.
This brings us into the third stage of disaster management, which is the response. Emergencies are dealt with through public services such as first responders, medical professionals in hospitals, fire departments, police, and municipalities. We then ask for assistance provincially and federally if the emergency escalates beyond our local capabilities. The National Emergency Response System was created to facilitate coordination between local, provincial, territorial, and federal governments in a state of emergency. The system identifies what each level of government's job is during a disaster to ensure coherency of emergency response.
As a nurse, the first step to response is knowing what the emergency is and being aware of the disaster plan. We need to gather information on the incident in order to provide the best informed care for our patients. A big job that nurses face during times of emergency is disaster triage. Disaster triage is the process of doing the greatest good for the greatest number of casualties. Nurses need to be prepared to care for an influx of patients who are highly stressed and have varying conditions or comorbidities.
The STAR tool was designed for use in the case of an event with mass casualties and is used by a triage nurse. Each color represents a different level of severity and the required care that goes along with it.
This is a great time to pause your video and review the details of the tool. The final stage in disaster management is the recovery. In this stage, all efforts are focused on rebuilding the community to the condition it was pre-disaster. The community may need assistance with the physical, psychological, and financial losses they had in the result of the disaster.
Through the Disaster Financial Assistance Arrangements, Public Safety Canada will financially assist provinces and territories when recovery costs exceed what they can pay on their own.
The Canadian Nurses Association released a position statement in 2018 on emergency preparedness and response. In this statement, they outlined the role of a nurse during the recovery stage. These roles include providing care, contributing to the capacity to conduct health surveillance, educating health professionals, volunteers, and the public, assessing needs and allocating resources, evaluating response measures, and making decisions about limited resource allocation. Now that we have gone over the stages of disaster management and the nurse's role throughout these stages, how can we become expert nurses in disaster management?
Nurses can have up-to-date first aid, field triage, advanced basic life support and infection control training. They can also partake in practice drills and mock emergency scenarios to ensure they know how to respond to an emergency.
By participating in simulated disaster exercises, nurses build on their working knowledge, confidence, sense of self-efficacy, and their perceived abilities relating to leadership when managing clinical scenarios. It is important to participate in these often so that the competency is not lost. Lastly, it is essential to be actively involved in all stages to improve familiarity and have a better understanding of roles and responsibilities during a disaster. Now that you have viewed this video, you should be able to define a disaster and disaster management, identify the 4 stages of disaster management, differentiate the nurse's role between the stages of disaster, and demonstrate expert nurse skills in disaster management within your current role.
If you would like to test your knowledge on the contents of this video, type this link into your search bar.